kind of in with me. He's supposed to be doing the question and answers for corrective exercise, but we're just going to kind of tag team here since it's 3 o'clock. So have any of you guys had any replacement? 1? 2? Maybe 3? Any of you guys thinking about getting a replacement? Oh, that's good. So coming with the replacements and lower back pain, knee pain, shoulder pain is where the Restore program comes in. And the Restore program is set up to help anybody that may have this pain and isn't quite ready for some kind of replacement or is not sure why they're having pain. So what we do is help balance out muscles. So if you have an overactive muscle on one side and the opposing muscle that works in conjunction with it will start lengthening. So if you think about a rubber band, and this is one side of your muscle and this is the other side, like the front of your quad and your hamstring. If one side starts lengthening and the other side starts tightening, what's going to happen? It's going to break or it's going to be off balance, right? So our goal is to help make the overactive muscle relax and strengthen the underactive muscle so they're both equal on a joint. That way one muscle isn't pulling, causing the joint to go off center, causing inflammation. And when there's inflammation, then that arthritis starts happening where it starts taking away the cartilage in the joint. So our goal is to rebalance that out, that way you're not getting those pains. A lot of people come in for knee replacements or shoulder replacement. They're not really quite sure if they need one or what the pain is. So we want to get down to those roots and see where the pain's coming from and help balance you out. And then if we can't balance you out, that's when you get to go and meet Dr. Cherry. On the flip side of that is he was talking about whenever you come out of rehab or before going into it, pre-exercise is very important. I know Pat just came out of surgery and statistics are showing that once you have exercise before you go into surgery, then you come out around 73% of faster recovery. And what are you, a month ahead of schedule already, Pat?
Month and a half ahead of schedule.
So Pat's already a month and a half ahead of schedule. That's a little testimony there because she has been coming in, getting work on that done before she went in and had surgery. And now she's back to boot camp. So, and it's only been 2 months since your surgery.
Yep, 8 weeks this week passed.
Yeah, and she's already back in the boot camp, so that's a good testimony right there.
Wow.
And I need to beat her up more. So on the other side to that, whenever you do have physical therapy, another part of Restore is you're usually like in a sling or a boot or you're on crutches or something, and other muscles start compensating for the injury to help you get those movements done. So what we want to do is help that contralateral side, that way you're not overusing that knee or that hip or that shoulder, trying to do all the work for the other shoulder and limping around like that. So we want to help those muscles, balance them out, keep their strength, that way the other side of the body knows what to do whenever you come out of physical therapy, so you're recovering faster from that standpoint too.
The whole idea behind they call it PNF, or program neuromuscular facilitation. It's a big word for what we're trying to do with the foam roller and the stick, is to override reflex mechanisms of your muscle. Okay? So your reflex mechanism is to tighten up as soon as we put pressure on it. And we're trying to override that to allow the muscle to relax and allow it to stretch. Okay? So yeah, that's why when we put that stick and we ask you to relax, and it is counterintuitive. We want you to try to stay as relaxed as possible so we can override that system. So just to give you a quick, because that's a really good question, a quick scientific background on corrective exercise. Normally, like Heather was saying, there's an overactive muscle. But muscles work in conjunctions with other muscles. Let's take, for example, your bicep. Okay? When you activate your bicep, your tricep has to relax. Okay? Your bicep and tricep work in conjunction to allow your arm to flex and extend. Okay? If your bicep is overactive, your tricep is not going to work the way it's supposed to. So you can take any muscle of the body, there's going to be a muscle that opposes it. okay? Overuse injuries always have an overactive muscle and an underactive muscle related to that particular overuse injury. Okay, so I know I'm kind of going a long way to answer your question. So what we try to do, the first stage of corrective exercise is to inhibit that overactive muscle, and that's what that is. The sticking and the foam rolling is to inhibit the overactive, that way we can get the weaker muscle or the underactive muscle firing and doing the job they're supposed to be doing. If the cartilage is still present between the bones, you guys have all probably heard of traction, like where you traction, like we do ankle tractioning. Some people do inversion tables to traction their spine. You can do tractioning in certain joints to increase the distance between them and allow better range of motion through the joint, so exercise will help with that. Now, if cartilage is no longer present, then we have a problem because now there's an orthopedic issue in the way. So we can still do some traction, but now when you start exercising and increasing the range of motion of the joint, you might actually aggravate the problem because there's no cartilage to protect the bone in that area. Does that make sense?